from bad hair to bad breath. Halitosis is a tricky problem for us GPs, not because we're particularly prone to it, you understand, but because we're often the last port of call for desperate patients. People complaining of persistent bad breath often end up coming back to their GP after their dentist has checked their mouth and various specialists have looked at their throats, lungs and stomach. So what can the GP add if there's no abnormality to find? Well, the first thing he or she can do is actually check that their patient has bad breath. Offering to smell someone's breath can be embarrassing for both parties, but it's essential, as I discovered when I met Tim Hodgson, consultant in oral medicine at the Eastman Dental Hospital in London.
I think the most important thing to say to these individuals is it there or is it not? And you've got to be very careful how you say it, because often these people are coming to you with a problem that they feel is real. And then if you turn immediately around to them and say this is not real, you can run into problems. But I think it's very important within the first discussion to smell the breath, because that's the gold standard test. And if they haven't got bad breath, you can say at that moment in time they don't have halitosis, but it's possible that in times previously that they had. And it's often the case that people have halitosis, address their gum health.
And gum health being the most common cause.
Yeah. And after that, they're left with this perception that they've still got halitosis, even though they've corrected the cause. And that's sometimes reinforced by family members, friends and relatives. And often they come along with a very considered construct that people on the bus or on the tube are turning away from them or covering their face or won't talk to them directly because they feel they've got bad breath. And they look almost looking for people who are avoiding them because of their bad breath.
And that reinforces their notion that they've got
it reinforces and it helps build a construct in their own head.
And as a rough guide, what sort of proportion of people that you see here with halitosis would, in your mind, not necessarily have a real problem, but have a perceived problem? Are they a significant minority?
I would say probably 80% who patients referred with halitosis to our service don't have halitosis.
Do they believe you when you smell their breath and say, look, I can't smell anything?
Some do, and others don't.
Working alongside Tim Hodgson at the Eastman Dental Hospital is clinical psychologist Claire Daniel.
For some of these people, they may well have had halitosis in the past, so they've set up this way of thinking. We work in a cognitive behavioural way, which basically looks at the way in which people think, the way in which they feel, what they do, and physical symptoms and how they all interact. So this patient in the past may well have had halitosis. They've set up this belief system, thinking about their breath, maybe they're focusing on their breath. And as Tim said, they've had past experiences of people reinforcing that they've got halitosis. Now, even if the halitosis disappears, some patients may well remain quite anxious about that, and so they will keep focusing on their potential symptoms. And they become very biased in the way in which they see and hear information, so they'll become very focused on the negative stuff that will reinforce their beliefs and will sort of ignore the other bits of information that may well support a more helpful, more realistic way of thinking about their situation.
So when a doctor or a dentist tells them that they haven't got bad breath, they say, well, that's not true, or I haven't got my bad breath today, but trust me, I had it yesterday because I saw someone in the pub wince.
Yes, absolutely. So it's either, well, yes, it's okay today, but it wasn't yesterday, or it won't be tomorrow. But also, some people initially will be reassured by somebody saying they haven't got bad breath. But as we know, reassurance for people who believe they have medical difficulties can only be short-lived for most people. So they'll feel very reassured in their consulting room, then they'll go home and their whole belief system will trigger again and may be reinforced by other people. And so their anxiety maintains.
Looking at this from the outside, Tim's got perhaps the easy part of the job. He's the one who said, look, I don't think you have halitosis, and he then does the referral to you.
Absolutely.
And you've got to do something about what's quite a complex problem. So what can you do and how successful might you be?
It's very complex. Cognitive behavioural therapy for sort of anxiety about health in general, we don't set out to tell people that they're wrong. We set out to try and help people understand what's going on. So we don't just talk about their physical reported symptoms. We'll talk about the way in which they're interpreting things, the way in which they're thinking about things, and how those interpretations actually may be unhelpful. They might seem helpful to the patient, like go to the doctor, go to the dentist, focus on their breath to check, maybe clean their teeth, but actually in the long term they can be very unhelpful and maintain the problem. So we help people to take a broader outlook on their situation. We don't tell them what it's not, we help them to understand what it could be, and then we help them to develop evidence to support what it could be rather than maybe what it's not.
And practically what is involved? I mean, how often do you see them?
So we'd see people maybe every week, every 2 weeks.
Is this one-on-one?
Yes, one-on-one for this particular condition. One-on-one, so one patient with one psychologist for about 50 minutes, on average about 8 times.
And in terms of success rate, how effective is it?
I would say we do help, particularly with halitosis, we probably help about 80 to 90% of people.
That's pretty good.
But then it's a continuum. You know, we might help some people just a little bit. And I think with things like anxiety about health, it's a lifelong issue. We're not just going to suddenly stop people's anxieties. It's about helping them to live with uncertainty and live with a degree of anxiety about their condition. So they'll still have times when they think their breath smells.
Clinical psychologist Claire Daniel. Just time to tell you about the next Inside Health, when I'll be investigating a side effect of cancer treatment.